My name is Abdulrazak. The world we live in today is faced by a myriad of complex, wicked problems arising from the interplay between humans, animals, and their shared environment. These problems have continued to be a threat to the existence of humanity and would definitely require novel solutions to tackle them. One Health as a concept or a discipline aims to do this. Although not a new concept, the implementation of One Health globally has been slow, and this is even more pronounced in developing countries. Now, this is due to issues that range from poor leadership structures to weak health systems for animal and human health to poor collaborations between countries both locally and internationally. To tackle this problem will require us to take a leaf from the current concept, tripartite concept, by the World Health Organization, Food and Agricultural Organization, and World Organization for Animal Health. This tripartite concept for One Health by these three international organizations, although not perfect, would need more synergy and improvement. And when this is done, a prototype will be created for countries all over the world to follow. Now, at the national level, we would need to set up structures, build capacity. We need to put more funding into health structures for human health, for animal health, and also for environmental monitoring. When this is done, this would improve the implementation of One Health strategies in this country, in most of these countries. Another major component of improving the implementation of One Health in countries would be a transnational, or should I say, transnational collaboration, regional collaboration between countries. For example, the South African Center for Disease Control has a surveillance system set up in which it collaborates with countries like Ethiopia, Uganda, Chad, and so on. Such an example, such a concept is important in the sense that countries can share their data and tend to come up with policies that would be applicable in Africa generally. Apart from strong collaborations or multidisciplinary collaborations, there needs to be involvement of the local context when coming up with One Health strategies or concepts. This has always been missing when it comes to international programs, and I think One Health is not excluded from this. So when One Health concepts are being programs and strategies are being set up, there needs to be involvement or participation of the people at the local level. They need to also bring in their views. Their views need to be heard, so that when we're coming up with solutions, we'll be able to come up with solutions that will be acceptable by them and also acceptable by the stakeholders. So this participatory approach is also very important to make sure there's implementation of One Health strategies. Another thing that can help to help another thing that can help implementation would be advocacy. Over the years, we've had people like Greta Thunberg, who has been very active as a young girl, clamoring for changes in climate. Also in Nigeria here, we have the late Ken Saro-Wiwa, and we also have Nemo Basi, who have been active in advocating for all the environmental changes that have led to consequences to people in the Niger Delta. Such people were able to win cases in court and get the government to be active and make sure that all the damages or consequences of urbanization in these areas are at least limited, and then also there should be some help to the communities in these areas, and then put up strategies to prevent such from happening in the future. So I will end by saying, going with the saying of Sharon Dean, in which she says, "We have one home, and in it, all life is connected by One Health, and we need to come up with novel strategies to tackle all the wicked problems that have been we're facing today. Thank you.